Muhterem konferans azası, ben öncelikle çok faydalandım bu toplantıdan. Benim çok öncelikli gördüğüm cerrahide bir konu değildir. Hani cerrahi eğitimin teorik olarak tartışılması, konuşulması, ama bütün konuşmalardan, tartışmalardan çok fayda gördüm. Toplantıyı düzenlemekte çok emeği olan abilerime, arkadaşlarıma da çok teşekkür ederim bu nedenle. Cerrahide profesyonellik üzerine bir çok da gene benim çok fikir sahibi önceden olmadığım bir konu konuşulacak. Merakla bekliyorum konuşmayı.
I want to invite Prof.Dr. Traynor for his speech, Professionalism in 21st Century in Medical Practice. Thank you very much.
Mr. Chairman, ladies and gentlemen, good morning again. I'm very happy to have an opportunity this morning to talk to you on the very important topic of professionalism in 21st century medical practice, and to share with you some of the initiatives which we have undertaken in the Royal College of Surgeons in Ireland to improve the teaching of professionalism for our young doctors of the future. I realize that there is no translator here this morning, so I hope that you can all understand my Irish accent. Development of appropriate values, attitudes, and behaviors is a really important part of the professional development of all doctors. The collective embodiment of those values, attitudes, and behaviors is called professionalism, and it forms an important part of our contract with society. It is this implicit contract with society that actually makes us a profession and that differentiates us from other careers, occupations, or trades. Put quite simply, professionalism is at the heart of being a good doctor. Unfortunately, professionalism is one of those things that seems to attract more attention when it is not present than when it is present. Over the past 20 years, many countries around the world have had high-profile examples of poor professional behavior and poor professional performance by doctors. These cases have eroded the confidence of the public in our profession, and particularly have eroded the confidence of the public in our ability to regulate our own affairs. That has shed new focus on the importance of professionalism in 21st century practice, and particularly has shed focus on how we should teach professionalism to our young doctors of the future. But although professionalism is very topical right now, in fact, the concept is not at all new. In fact, professionalism dates back to the time of Hippocrates, almost 2,500 years ago. As you probably know, Hippocrates practiced on the tiny Greek island of Kos. And it was Hippocrates practicing in the Asclepion of Kos, which is a forerunner of the modern-day hospital, and it was whilst working here that he outlined the principles of professional behavior and practice for medical doctors. These principles were later enshrined in the Oath of Hippocrates, the Hippocratic Oath, which is still taken by graduating doctors around the world to this day. So how do we actually teach professional values and behaviors to our doctors of the future? Well, I spoke yesterday about the traditional apprenticeship model of training, which is the model that has been used for surgical training for more than 100 years. And I mentioned the two essential ingredients of the opportunity to engage in large volume, repeated practice, but also, very importantly, the relationship, the professional relationship between trainer and trainee. A relationship in which the trainer becomes a role model. And it is through this role modeling effect that most of us have learned our professional values and behaviors over the years. There is no formal didactic teaching of professionalism. Instead, we emulate the behaviors and practices of our senior colleagues. Role models are really important in life. From earliest childhood, our parents act as role models. Later, as we go to school, school teachers, sports coaches, and youth leaders act as role models. But even in adult life, we all have individuals whose values, attitudes, and behaviors we admire and wish to emulate, whether they be sports stars, business entrepreneurs, politicians, or activists for social change. The fact is that role models are a very important influence on human behavior. And so too it is in surgery. Our senior colleagues have traditionally been our role models, and we have learned our behaviors and values and attitudes from our senior colleagues. But for various reasons, as I outlined yesterday, that is becoming less of an influence, because trainees around the world are spending less time in the hospital with restrictions on working hours and with the shortening and streamlining of training. And so we need to think about how we are going to teach professionalism to our trainees of the future. At the Royal College of Surgeons in Ireland, we have been looking at this problem over the past number of years, and we have designed an online course on professionalism, which has just recently been launched and which is available for all doctors in all specialties in Ireland. So it's not specific for surgeons, it's applicable to doctors of all specialties. The program, as I said, is an online course which was developed in collaboration with a commercial media development company. The course is designed across the Irish Medical Council's Guide to Professional Conduct and Ethics for Registered Medical Practitioners. So the Medical Council in Ireland is the regulator of the medical profession. And in 2016, they produced this Guide to Professional Behavior and Performance for Medical Doctors. And our course is based on that. So our course is grouped into three main areas, covering partnership, practice, and performance. We have 12 modules in total in the course. So in the area of partnership, we have 4 modules which deal exclusively with relationships. Relationships with patients, relationships with colleagues, and relationships with society. Our modules on practice deal with ethical practice, maintaining health and fitness to practice, continuity of care, and patient safety. And the modules on performance deal with professional performance, honesty and integrity, confidentiality, and teaching and mentoring. The program is specifically designed to be available on any mobile device, and particularly the smartphone, so that doctors can access this course anytime, anywhere, and can take it in big or small chunks depending on their particular circumstances at the time. So it's designed to be used whenever and wherever suits the doctors who are studying it. Within each module, and as I said, there are 12 modules in the course, within each module there are a number of thematic areas. So for example, in the first module on relationships with patients, we have sub-modules or thematic areas dealing with the doctor-patient relationship and issues around power imbalance and empathy and compassion. We have a sub-module on respect, cultural diversity, discrimination and bias. On advocacy, the duty of advocacy and prioritizing clinical care. And trust, personal relationships with patients and issues around treating our own family members. These are the sort of sub-areas that are within each module. Each module has 4 component parts. So there is an introductory video for each module, and this video was prepared by the commercial media development group that we were dealing with. The participants then move into the learning resource area, where there is a wealth of supplemental educational materials relevant to the subject matter of that module. On completion of the reading and viewing material in the learning resource area, participants can take an MCQ test, and if they pass the MCQ test, they get their CPD points and can download their CPD certificate. So what I'd like to do now is to show you two examples of the module videos. So the first one I'm going to show you is a module video from Relationships with Patients, dealing with the whole area of empathy and compassion. And I'm hoping it's going to run. Good.
Patients are fellow human beings who are sick, unwell, or possibly even at risk of dying, and they want to be cured. They come to us as doctors in the hope that we can make them better, or maybe even save their lives. Patients are fellow human beings who are sick, unwell, or possibly even at risk of dying, and they want to be cured. They come to us as doctors in the hope that we can make them better, or maybe even save their lives. The fundamental nature of this relationship is therefore one of power imbalance. Patients are vulnerable and in need. We are powerful and in control. The most basic element of professionalism is that we recognize and respect the nature of this relationship, and that we treat all of our patients with compassion and empathy, at all times putting the needs of our patients, both physical and emotional, as our top priority. It is important to note, however, that the individual relationship between doctor and patient is just as important in today's high-tech healthcare environment as it was hundreds of years ago. Take a moment to consider the following. Compassion and empathy are important professional behaviors for all doctors. Have you ever missed an opportunity to demonstrate empathy to a patient, perhaps because you were too tired, or rushed, or overworked?
So at the end of each module video, there's a little time for reflection based on the question that was posed at the end of the video. So I'm going to show you now just a different example from a completely different part of the course, and this is a video dealing with the whole area of ethical introduction of new techniques and new procedures into clinical practice.
The practice of medicine in the 21st century practice of medicine in the 21st century is becoming more and more embedded in complex technology. New diagnostic modalities, new treatment regimes, and new interventional procedures are emerging at a rapid rate. Whilst all of these offer exciting opportunities for new ways to diagnose and treat illness, there are also risks and challenges associated with their introduction into clinical practice. The knowledge and skills which we acquire during training do not necessarily equip us to engage with new technological advances. We have a professional obligation to ensure that we are fully trained, competent, and if possible, credentialed to use newly emerged technologies before using them in our own practice. Where appropriate, we should use simulation to support learning of new interventional procedures and achieve documented competence. If possible, we should use a mentor to oversee our early use of new techniques or procedures. Introduction of new techniques, devices, or technologies should comply with local ethics committee requirements and should be underpinned by robust clinical governance processes. Patients and their supporters should be appropriately counselled and consented before being given access to new technology or procedures. We must ensure that all new medical devices and technologies have complied fully with European standards and are certified by the relevant competent body. Now take some time to consider the following: getting balance right between being seen to be an early adopter and patient safety. The last time a new piece of equipment or new procedure was used by you or a member of your team, did you inform the patient that this was going to occur? Did you satisfy yourself that all staff, including yourself, were suitably trained to use the equipment or procedure?
So after watching the module video for each module, the participant then enters the learning resource area. Yeah, keep forward. They enter the learning resource area where they will find scientific publications and videos relevant to the subject matter of that tutorial. So these are scientific papers which have been handpicked by our team as relevant and current papers relevant to the subject matter of that module. On average, there would be 7 to 10 publications within each module and maybe 3 or 4 videos. These are not videos that were prepared by ourselves, but videos that are available, usually available on the internet. So these papers are designed, and the videos are designed to be studied and watched in preparation for the MCQ test. I'm going to show you an example of some of the papers. So these are papers like this seminal paper by Lucy and Leap on the culture of respect and the origins and nature of disrespectful behavior among physicians. Or there's one on an evidence-based approach to addressing residents with behavioral problems. So they're all very high-impact, prestigious papers which have been hand-chosen by our team for their relevance and currency. Likewise with the videos, they're all videos which have been chosen for their quality, and I'm going to just hopefully show you an example of one such video. This is a video that was produced by the Cleveland Clinic in the United States, and it deals with the whole subject of empathy. So this is about 4 minutes in duration, and it's a really, for me, a really powerful video. And it's particularly powerful because during the 4 minutes of the video, not one single word is spoken. Can we run that video? I hope we can. Everybody has a story. Every patient we treat, every colleague we work with has something going on in their lives. Sometimes it's good, sometimes it's not so good. Empathy is about our ability to tap into what's going on in other people's lives. And empathy is a core skill for all doctors. Can we move on to the next slide, please? So, after the participants have completed the learning material, the reading and the viewing material, they can then take the MCQ test. So for each module, there are 50 questions in the MCQ, and these are simple true-false questions, which are simply designed to test if the participant has studied the material in the learning resource area. It's not intended to be a high-stakes assessment. It's a simple verification that the participants have completed the studying material in the learning resource area. If the participant gets a score of 80% in the MCQ, they can then go down to the CPD certificate and they can directly download and print their CPD certificate. So what we have tried to do with this course is to develop a course which is got an academic background dealing with the whole area of professionalism. It is an opportunity for participants to gain valuable CPD points for their professional development program. It's particularly designed to be accessible on any mobile device, but particularly the smartphone, and it's available for doctors of all specialties, not just surgeons. Thank you.
Thank you very much, Professor Traynor, for this enlightening speech. Sorusu ya da katkısı olan var mı acaba? Buyurun.
Thank you for this inspiring presentation. I'm Zeynep, Chief Resident of Cardiac Surgery. Firstly, I want to say what I think about role model. I 100% agree with you. Role model is very important, and if you have a mentor like this who has the feeling of, when I grow up, I want to be you, it is the right mentor. And as a mentee and mentor, the common part of it is mental equality, and it is very important. But on the other hand, professionalism is very important, and what you say, empathy, are actually the basic principle of human being, and you are really right. But actually there are lots of international fellows all around the world, and when you go there, you can confront with the cultural differences, and to perform the real empathy, you need to cope with these cultural differences. In fact, I like these modules. They are great, but I want to ask, actually I don't know how to do. Do you have any program, an alternative short-term program for these cultural differences for your international fellows to express, for example, your education system, your family values, someone like this? And thank you for your answer.
Yes, we do. We do have another online program dealing with culture and diversity. Obviously, it wasn't possible for time constraints to include that here today, but we do have a short online program dealing with culture and diversity.
Başka soruya da katkısı olan var mı acaba? I want to ask a question, Professor Traynor. What do you think about the impact of mobbing in developing a professional attitude in that respect? Because mobbing.
Sorry, I don't understand that. The impact of?
Mobbing. Structured attempt to Nasıl anlatabiliriz? Var mı başka alternatif şeyler? Abuse. Or apprentice.
The impact of moving.
No, mobbing.
Sorry,
Keşke sormasaydım.
Using your position in inappropriately, putting a lot of pressure to the trainee and abusing him or her.
Okay, yes, I understand what you're talking about. Yes, this is a really topical issue right now in many countries around the world. And some of you may have read about the issues in the Australian College of Surgeons in relation to bullying and harassment of trainees by senior colleagues. And a lot of colleges around the world, particularly led by the Australasian College, have introduced policies and training programs around harassment and bullying of junior colleagues. So it is a big issue. It's a very topical issue at the moment, and it's, I think, an international problem.
Thank you very much.
Thank you very much. Is there any questions?
Thank you. My name is Sarah Kochi. I'm an international student here, 4th year. Actually, I've come across, while talking with my friends, with some friends who have chosen medicine only because it's a highly respectable profession, and it's profitable as well, but have shown no kind of empathy towards their patients in the future. I wanted to ask, in which way can this professional course teach them empathy and compassion? And according to you, how can we as friends, mentors, teachers, can teach these medical students who will eventually become doctors in the future, the wide range of emotions that this medical profession requires? Thank you.
I think it's a really important professional responsibility of all of us, of doctors, to preserve the professionalism of our profession. I think we are all conscious of the fact that around the world there are pressures to deprofessionalize our profession. Governments, politicians are trying to deprofessionalize the profession and turn us into civil servants, workers for the government. We must resist that, and only we can do that. We must maintain our professional values and behaviors. Otherwise, they will win.
Öğle yemeği için ara veriyoruz sanırım, değil mi?
Thank you, sir.